Recording in progress.
So, hello, doctor. So, I want us to do another review, and today's review is going to be on the subject of therapeutic decision making, TDM. It's one of the exams we also take in Canada. So, let's just get into it right away and get it going. So, it's a TDM exam prep highlight. It's broken into two. We have part one, and then later on the part two will come. But for today, I want us to do a quick review of some common teratogenic medications to know for your TDM exam. And as I said, this is going to just be the part one. Because, you know, pregnancy is very important, and drug use in pregnancy is something you need to know. Like, you just need to know. There's no excuse about that. So let's get into it. As usual, I'll need all your attention. So look, if you can put your phone on airplane mode, you can all things plain, because this is going to be very short and straight to the point. And as I said, give me your full attention. Let's review this. And then after that, you can have the rest of the time to yourself. So my point is simple, that in preparing for the TDM exam, you know that there are medications with proven teratogenic effects on human fetuses, of human babies. So you've got to know it, because pregnant women are a very important patient group in our demographic, all right? So review it. It's very, very important. And that's why I want to make it very simple for you. So list of medications with proven teratogenic effects in pregnancy. At least these are the common presentations. So you have like ACE inhibitors, you have carbamazepine, which we use for seizures, you have cocaine, because some people may abuse them. We have steroids, but this one, because you will, oh my, but if a patient has, say, preeclampsia, at times we give steroids to mature the lungs of the baby. So why are you saying it's teratogenic? So that's why I really put it in the bracket that usually if it is used in the first trimester, okay? Another key medication you want to pay attention to is warfarin, and then diethylstilbestrol, alcohol, valproic acid, methotrexate, phenytoin. We also use that in, seizures, lithium for maybe bipolar patients, misoprostol, isotretinoin maybe for patients with, acne, tetracyclines, thalidomide. So just review this very well, know at least 7 of them, so that if you need to do a list of medications with proven teratogenic effects, you can easily do that. Now, I want you to pause the video and go back to the list of medications we just listed. And each of them, I want you to try and see if you can list 1 or 2 teratogenic effects, because that is the way to go. I've listed them for you. So pause the video here, stay on this frame, and try on your own and see if you can do that, okay? So I'll just continue to present so that, but I expect you to pause the video. Get a piece of paper, get a pen, and just review it. So let's get into it. One key medication I want us to review is ACE inhibitors. We use ACE inhibitors for like in diabetes, and patients with in diabetes with, renal impairment. So we use it as renal protective medication, or even patients with high blood pressure. It's a blood pressure medication, literally. So the side effects in pregnant women is that it can cause intrauterine renal insufficiency. It can also lead to neonatal hypotension, decreased blood pressure in the baby, neonatal renal failure, hyperkalemia in the baby, oligohydramnios, that is decreased fluid around the baby, and that can lead to complications like fetal limb contractions, because the baby does not have enough space to move the limb, okay? Lung hypoplasia and craniofacial abnormalities, as well as prematurity, intrauterine growth restriction, and fetal death. So don't give ACE inhibitors to pregnant women. Don't. All right? It's a no-go area. Another medication you want to pay attention to is carbamazepine. So carbamazepine can cause, neural tube defects and cardiovascular complications and malformations in the unborn baby as well. So you also want to pay attention to that. So with each of these medications, pause then write it down. Try to memorize it. Try to, know at least one or two, okay, complications when used in pregnancy. Another medication you want to pay attention to is, for example, the patient in her social history takes cocaine. Cocaine can lead to placental abruption, prematurity, fetal death, decreased birth weight, microcephaly, limb defects, urinary tract malformations, and poor neurodevelopmental delays, okay? And then steroids, as I said, the caveat here is, especially if it is used in the first trimester. So please note that very well. Usually that can lead to oral clefts, so cleft palates and, all that. So, what about warfarin? So warfarin may be in a patient with atrial fibrillation, it can lead to fetal warfarin syndrome. It can also lead to IUGR, intrauterine growth restriction, can lead to CNS underdevelopment, can lead to eye defects as well in the baby, and hearing loss. So these are complications of warfarin in pregnant women on their babies that you want to also know. And diethylstilbestrol, it was a medication which was used formerly. Currently, it is not being prescribed in Canada, but it's necessary you know something about it. So it can cause vaginal clear cell cancers. It can also lead to benign vaginal adenosis and miscarriage of the baby and preterm delivery. So diethylstilbestrol, you want to pay attention to that as well. And then alcohol, so that's why when you are taking your history, for example, if you're taking your Narcoski, you want to encourage pregnant women to avoid the use of alcohol, because alcohol can lead to fetal alcohol syndrome. And I'm sure while preparing for your QE1, you learned the components of fetal alcohol syndrome. If not, just, after that, check it out. It can also lead to cleft palate and heart abnormalities in the unborn baby or the fetus. And then methotrexate. Methotrexate, we use it for various reasons. And if a pregnant woman is on methotrexate and she is carrying the baby, it can lead to CNS defects in the baby. It can also lead to craniofacial abnormalities. It can lead to abnormal cranial ossification. So, abnormal ossification of the calvarium. It can also lead to IUGR, intrauterine growth restriction. And methotrexate can also lead to mental retardation, okay? So I want to pause the video here because I don't want to overwhelm you with information. And I promise you that I'll be doing the part 2 as well. And you will have access to it. So all the best in your exam preparation. And thank you for giving me your attention. Please go over this video over and over and over again. And make sure that you can list some of the medications. You can list some of the associated complications in the baby. And, good luck in your exam. And keep a positive mind, positive vibes, and a positive life. All the best, okay? All the best.